Many a times you see children who are 4 and 5 with the tablets and all. The parents say that they can't see or they're squinting, and the ophthalmologist realizes that there's a number. If it's a myop and if the number is large, -3, -4, definitely then these myopic lenses they're good for the children. I prescribe them. Yes, what's very important is regularly the parents must remember to come and get the children rechecked, say 6 to 8 months. At least till the number remains stable. Oxygen content of the contact lens is very little, so the body mechanism is in such a way that if it becomes hypoxic or avascular, less of oxygen going to that tissue, then new blood vessels start growing, and it grows from the periphery, which is not good. Yes. Absolutely not good. The yearly contact lenses gets protein deposits, and these are dangerous for the cornea. Lens-induced infections are very, very dangerous, can lead to blindness if not treated. Every second, every third person who comes, they're diabetic, which I don't remember seeing 20 years back when I started my practice. Or hypertensive retinopathy. Now, these are all our lifestyle, which is a very predominant factor for this. We check for the retina, which is absolutely mandatory. We see for diabetic retinopathy, which is again the third largest cause of blindness in India after cataracts. But cataracts can be always operated and it's preventable. But diabetic retinopathy is very highly prevalent in our country. Every adult in our country should get their eyes checked. So I think age 40 it starts, and then definitely by age 50 every individual should get the retinal examination done. It's mandatory. There's a very fine difference between age-related lens changes and then what we call as a cataract. Yeah. So everyone starts developing the lens changes after age 50. Some develop those changes faster, some take a longer period of time, some it remains static for years. We're becoming too westernized. Yes. I think if we go back to our roots and go back to our culture and go back to our habits, what our fathers and mothers taught us and fed us, I think we can revert a lot of things back.
Hello, welcome you all for yet another episode of Brainwise with Dr. Pallavi Prasad. And today we have Dr. Nairyosan Irani in our studio. He is ophthalmologist, MD, and he is a medical retina specialist. Welcome, sir.
Namaskar. Namaskar.
So, sir, first tell us why these days small kids are getting specs earlier.
Number of factors which are involved in this, why the specs are coming in younger children. Many other problems are coming in younger individuals. One of the main factors is your mobiles, your computers, your laptops, your tablets, which children are getting, they are using at an earlier age for long periods of time. I think this contributes very much to refractive errors, to numbers setting in. What happens is basically the whole idea is that when a child is born and they're small, the eye is small, so it's a hypermetrop or it's a plus number.
Yes.
As the child becomes about 10 or 11 years of age, the number goes to emetropia, that is zero number, and then it goes into a minus setting. Many a times you see children who are 4 and 5 with the tablets and all. They come with the complaints that the parents say that they can't see or they're squinting.
Yes.
So they end up with an ophthalmologist, and the ophthalmologist realizes that there's a number. So one of the common causes they say is that when they stress or they see small fonts,
Yes,
that's the time when the number starts appearing. That is a cause for one of the reasons for children getting numbers at an earlier age. Second is also diet, very important, which is a contributing factor. Nowadays, all the children are eating fast foods and they're going and eating all the processed food, canned food, tinned food.
Yes.
So all this also plays an effect on the physical state of the child as well as the eye, the muscles which are involved in accommodation. So that's another cause which can cause numbers to appear in small children.
So now what happens mother like me, we try to avoid mobiles or TVs, or we can say, but it's not possible 100% we can't restrict them to TV
True,
and mobile.
true.
1 hour, 2 hour they can watch. And Sundays we have to allow them for 3-4 hours. And for working mothers, there is no option than
No,
mobile.
true.
So what to do
Okay,
in
so
this
in
situation?
this situation also,
Yes.
nowadays small children they have online classes. We
Yes.
can't stop them from their
Yes,
online
yes.
classes. So the best thing, what is written, what we know about, and the knowledge is that everything should be done in bright light,
Yeah.
and the font size should be increased.
Yes.
Okay, the background, the font should be a bright and with a large font. That is absolutely mandatory.
Yeah.
And in a well lit environment, that's very important.
Yes.
And breaks in between as much as possible.
Yes.
What would be very appropriate for small children.
Nowadays, lots of products are there. They say ki it's a blue light or blue screen to protect the eyes. How much they protect the eyes?
See, in our books, it's not really mentioned. Okay, it is there. They say blue background. Some of them even say gray background is
Yes,
very good.
yes.
Even the glasses which they wear, they say that you should have this colored lenses
Yes.
and all. It's not really mentioned anywhere in our books what should be the shade of those lenses or the background.
I can take it, it's not that much effective.
It's not so effective.
Yeah.
Never really read anything
Yes.
anywhere across, or in the conferences mentioned about different background settings.
Yeah.
Yeah.
And I heard there are some drops. They can restrict the number, or they can prevent to increase the number.
Yeah, so we have
Is that true?
Yes, cycloplegic drops,
Yes.
dilating drops.
Yes.
So these help, or drops like atropine, which is they say every night to prescribe these drops for small children who already have a number. So it does not increase the refractive error much more, and it remains stable. I personally, depending on what the age of the child and how much is the refractive error, on that basis I give these cycloplegic drops which are prescribed. Also, this myopic lenses which are there, which has come into the market. There are certain lenses which are available, especially for myops, high myops, which they say that prescribing those lenses, the number does not jump, does not increase.
We can start with what age these lenses?
It depends the child. Usually the mother and father comes to us and they say that हमको लगता है बच्चे को दिख रहा नहीं है, नहीं तो आंख एक टेढ़ा हो रहा है. So that's the time we examine the child. That's usually 4, 5. Around that age they come to us and we examine and find that they have a refractive error. And so we give them a glass. If it's a myop and if the number is large, -3, -4, definitely then these myopic lenses are
Good.
They are good. They are good for the children. I prescribe them because we have had lectures on these lenses and they are supposed to be doing good for small children.
So with now we are if child has a glasses and we have to use regularly,
Right.
and now that number will not go. So they say ki some type of glasses are there available and they are very costly.
Precisely.
Precisely.
Yeah, these are
So those are effective, or we can use normal glasses
See,
also.
I have a wide range of patients that come to me. Obviously, when they can't spend 15 and 20,000 for those myopic
Correct.
lenses, we prescribe just go in for the ordinary lenses which are available. I mean, the ordinary lenses, we've been using them for years, for donkey's years. So, and it's work for children.
Yes.
Yes, what's very important is regularly the parents must remember to come and get the children rechecked.
Every
which
year
they-
or every 6 months?
I would say 6 to 8 months. At least till the number remains stable. So how it happens is a child comes, you examine the patient, a small number is there, I prescribe the lenses. I do call the child. Maybe people feel it's a little bit too early, but within 3 to 4 months, I call them for the first or the second visit,
Yes.
what we call. And on that basis, if the number is stable, then we might extend the duration to 6 to 8 months. But that is absolutely mandatory. Doesn't happen because many a times the children, they come, they take the glasses, and then you never see them, and after 3, 4 years they come.
Yes.
And a number which is myop of -1, 1.25 jumps to suddenly 4 or -5, which is detrimental for the children. So regular checkup is mandatory, absolutely mandatory.
Now we will shift to younger generations.
Okay.
They use lenses, color lenses. They
Yes.
want to look good. They don't want to use specs.
Cosmetically.
Yes,
Yeah.
yes. So,
Yeah.
and that those lenses make your eye dry.
Yes,
Yes.
precisely.
So, what
Okay,
you will
okay, so
suggest?
there are different lenses which are available in the market. Few years back, we didn't have much of a choice. It was yearly contact lenses. When I started my practice in 2000, 2002, we would give standard yearly contact lenses, which the patient would come, be happy, take, and go away. But they have problems. You develop issues, as you mentioned.
Yes.
The oxygen supply is not there to the cornea. So the cornea, which is an avascular tissue, if it was vascular, it wouldn't be transparent. It is an avascular tissue, but it needs its oxygen, it needs its food, which it gets from the air, and it gets from the white part of the eye, which is the sclera of the eye. Now, once a contact lens is put, the oxygen content of the contact lens is very little in yearly wearing contact lenses. So you make that tissue, you make it hypoxic. It remains hypoxic, or less of oxygen it receives for long periods of time. So the body mechanism is in such a way that if it becomes hypoxic or avascular, or less of oxygen going to that tissue, then new blood vessels start growing, and it grows from the periphery, which is not good. Absolutely not good. So new lenses, new technologies came into the market. Now you get 6 monthly lenses, you get 1 month lenses, you get daily contact lenses. So and the oxygen content is very high. So what goes through the lens to the cornea is definitely better. So it is, these lenses are good. And disposable lenses are always very much better. Also protects the eye from infection. The yearly contact lenses gets protein deposits, and these are dangerous for the cornea. Infections, lens induced infections are very, very dangerous, can lead to blindness if not treated. So as a result of which, the newer contact lenses which are there are better, and you keep changing them. What I advise to all boys and girls, especially girls, boys don't really go for contact lenses so often in my practice. But I said the weekends don't wear your lenses. When you go to college, when you go to wherever you're going for a party, wear your lenses. Rest of the time, keep your glasses on, so you can always change and give that rest to the cornea, to the eyes. So contact lenses are good, not bad. If I had a thick number when if I was 16, 18 years of it, I would definitely wear contact lenses. I don't think it's a bad, it's a,
But you have to be cautious.
but you got to be very careful. Remove them properly, maintain the hygiene, very, very important. Keep them in the proper solution, change the solution. Don't use tap water, the bathroom water which people use. They store it in bathroom, toilet water also, bucket water also, a whole lot of things we
And they don't understand that difference between water and that solution.
barobar. And
That solution is not water.
absolutely, absolutely. So that has to be looked into. And if all the precautions are taken, then contact lenses are a very good option for people if they don't want to wear their glasses
Last year, one
continuously.
incident happened with the one model. She wore infected lenses and she was blind for 48 hours.
Yeah, it happens. Yeah, because your cornea gets infected,
Yeah.
and acanthamoeba infections, which are very dangerous for the cornea as well as the eye as such. So, and then you have to got to treat it intensively with antibiotics, broad spectrum, gram negative, or for infections, for gram negative infections, you treat different types of you give different types of antibiotics for that. So yeah, so you just have to be careful what your contact lenses, how you maintain
One
them.
more incident happened 2 years back in Ganpati because of those rays which they use in functions and events. Those rays also damage the retina.
Yeah, you can have macular toxicity, which can develop a macular burns, which can occur due to, nowadays they use this laser lights or something. So yes, so never look into it. The same when we are doing the welding. We never we always, when someone is welding on
Yes,
the
yes,
road,
yes.
we people we tell them look away. It's not because you can burn your macula.
Yeah.
The same way with the sun. When you
Yes.
look at the eclipse and they
Yes.
burn, they say they burn the uh, retina. It's the
Yes.
macula gets a burn, and so yeah, you have to be cautious about these things.
Now we see young ladies mostly, they have a thyroid, and because of thyroid their immunity gets reduced. So because of that they get plus number early.
Yes, hypermetrop. Okay.
Hybrid. So what we can suggest for them?
Hypermetrop is a thing that will uh, come to anyone. It can come,
Anyone
yeah,
and any age
yes, it
nowadays.
can
Yes.
be at any age. Hypermetrops you see in children. Hypermetrops in children is very dangerous compared to myopes.
Yeah.
Hypermetrops develop something known as amblyopia,
Yeah.
that is poor sight, poor vision.
And
Which
how mother should know ki I should take my child to ophthalmologist for this?
they will notice that very often in hypermetrops or the plus number, the child's eye squints.
Ah.
Tera bhagta hai, he
Oh.
will mention.
Yeah.
That's the time when immediately should be taken to an ophthalmologist.
Yes.
So yeah, or the mother says TV bhagta hai, but he can't see properly. He goes right next to the screen.
हाँ.
जवळ जातोय. So that's the time when you realize and the parents realize and they take the child to the ophthalmologist for an eye check. Hypermetrops, if they have a number, must be given, must be worn. Many a times when these children come, they already have weak eyes, so they don't have 6/6 vision. Poor vision is there comparatively. So we also advise them patching. Patching is a very important thing that is done. That is with the good eye, with your glasses on, you close the good eye and you use only your weak eye for an hour or two in the day,
Okay.
twice or thrice in the week. So you use that eye, you use the retinal tissue, so the vision improves. So that's very
So this
important.
patching is you should
Yes, it should be done.
hide your
Good eye.
good eye,
Yeah, you close it, you patch it with the micropod tape and
yeah,
only use your
weaker eye.
weaker eye, your
Okay,
poor
and
vision.
for how many hours?
For an hour or so,
Yeah,
depending, all
depending on.
depending. Yeah, that's
But
very
daily.
important.
But it's a good exercise.
Not daily. Well, I prescribe alternate day, thrice a week, which
Okay.
is what I prescribe, because the mechanism goes this way. If you patch the good eye for long periods of time, then that becomes weak.
Yeah.
You don't want that to develop
Correct.
weakness also.
Yes,
So
yes,
it's just done for short periods of time.
Okay. And can we suggest some exercises for kids?
Yeah, there's a you hold your finger and you just bring it near your this eyes, between your eyes, for a minute or so. So you squint and you're focusing. So that increases helps to develop the eye muscles, the six ocular muscles which are there at the same time, the muscles inside the eye. So just basic exercises which are there. Nothing really as specific things.
Now, what type of corneal or retinal diseases are there, and we should look early for that?
Retinal diseases, all again depends in a very broad way you're talking. In our country, predominantly, I think we are prevalent. We have very high percentage of diabetics in our country. I think in the I don't think in the whole world there are so many diabetics than what we as Indians have. I mean, I examine every second, every third person who comes, they're diabetic. Age 40, age 42, age 50, which I don't remember seeing 20 years back when I started my practice. And or hypertensive retinopathy. Now, these are all, I think, again, these are issues of our lifestyle, our stress factors, everything that is involved in this.
Some people blame COVID also.
Yeah, we can blame everything, but I think generally I believe that it is our lifestyle which is a very predominant factor for this. An ophthalmologist must mandatory have a look. So when a patient comes to you and they say they are diabetic, we have to see the retina. We cannot bypass that, just give a number and send the patient away. We check for the retinas, which is absolutely mandatory. We see for diabetic retinopathy, which is again the third largest cause of blindness in India, after cataracts. But cataracts can be always operated and it's preventable. But diabetic retinopathy is it's very highly prevalent in our country. But there too, again, if it's detected early and proper treatment is given, yeah,
We can save eyes.
yeah, you can, yeah, because diabetic retinopathy again has got different stages. So when you go into stage 1 and it's detected, and you inform the patient and you tell them to be safeguard themselves, and if they do, then probably a year later we don't see those grade 1 diabetic retinopathy changes again. It's probably just back to normal. So there are different stages. The initial stages, it can revert back to normal. So very particular, go back to your diabetologist, inform them that they are got diabetic retinopathy changes and that they should look into it.
Yeah, and so the way we suggested the kids, they should come every 6 and 8 months.
Yes.
Like diabetic people also come every.
Adults, I think every adult in our country should get their eyes checked. I am See, as it is, when you turn 40, you become
Yes.
presbyopic.
Yes, yes.
You start getting a reading number, you realize you're getting younger.
Yeah.
You realize, अरे डॉक्टर दिसत नाही मला जवळचा. तर they come to you and then you give them a presbyopic correction. It usually starts with +1. Some prescribe at a smaller number, but it's at age 40 you start with +1.
Yes.
And then it goes every year or year and a half, it increases by 0.25. So that's the first time when they come to you at age 40. I think every ophthalmologist or a doctor should go into the basics, take the pressure of the eye for a condition known as glaucoma. That's another very, very, very predominant thing in our society. Glaucoma is, and it's a thing, irreversible damage that occurs to the eye. So I think at age 40 we should check the eyes for glaucoma, and we must check the retina. Absolutely mandatory, because many a times you see changes in the retina and then you tell the patient, go to your physician because I have noticed certain changes. So I think age 40 it starts, and then definitely if, by age 50 you should, every individual should get the retinal examination done. It's mandatory.
Sir, now tell me about cataract. What is the procedure, when they should come and when we should remove?
Okay, so how it goes is, usually a patient comes to us that भुरकट दिसतंय,
हो.
मंद मंद दिसतंय.
Correct.
So they come to us, we can't see, we examine. Many a times they have a refractive error, we give them the glasses and send them off. But many a times on examination, on slit lamp examination, we realize they have a cataract. So in my practice, anyway, a cataract starts after the age of 50. Age-related lens change is what we call. There's a very fine difference between age-related lens changes and then what we call as a cataract.
Yeah.
So everyone starts developing the lens changes after age 50. Some develop those changes faster, some take a longer period of time, some it remains static for years. So what I do in my practice is, I see it with regards to the vision and also the type of person, the type of profession they are in. A housewife with a just age-related lens change, and we can give some refractive error and send the patient off, and she's happy and she can see 6/6. We try to delay the cataract. Yeah. Then there are people who are very active, CEOs, doctors who come. Of course, they require their vision for distant, near, intermediate, and then on examination, we realize that there is loss of vision, and along with symptoms like photophobia, blurred vision, especially driving in the evening when the headlights come on to the eye. They say दिसतच नाही काही. So in this cases, we tell them they have these changes. They can be initial or they can be advanced, and then we advise them. The only procedure we can suggest is them a cataract surgery. Nowadays, cataract is done on OPD basis. We don't admit the patient. We just get the blood tests done. Tests are normal. We plan for surgeries. The big question comes on the type of lenses you want to implant. That's another thing probably you'd ask me about.
Yeah.
So right up to COVID, I'm a very conservative type of surgeon. I was implanting monofocal lenses in all my surgeries because I was coming across people who were putting multifocal lenses. but multifocal lenses have problems with them, photophobia and basically a glare issue which they
Yes.
develop, which is terrible. So I was always with a monofocal lens, give them good distant vision and give them reading glasses. Later on in my surgeries, as time passed, I would give them good one distant vision, the other eye a good near vision. So they would manage most of the while without lenses or glasses. But since a couple of years, we have these EDOF lenses, extended depth lenses which are available, or trifocals where
Yes.
the rings are not there, or just maybe just a single ring that is there. So the glare issue is not there. The light doesn't burst. There's no breaking up of the light which occurs through the lenses. So I've started implanting these lenses and they're very, very good. And as time is passing, there are newer and newer lenses which are coming, which are good. Another thing I've noticed in cataract is when I started practice, you saw the cataracts developing after age 55, 60. Nowadays, we are operating young people.
Yeah.
This is again a thing of our lifestyle, our diet, probably maybe the screens which we are using. There's no one can definitely say that the cataracts are in younger people. Like a few days back, I operated a young guy who had a cataract two 3 days back. So it's more often you see younger people with cataracts. Number of factors involved, as I said, and yeah, they're good surgeries, done well, mastered well. The patient, and if it's the patient does well with them.
Yes.
Yeah.
Please tell me 5 things we should do as a precaution
To avoid cataracts.
and
To avoid
to avoid
this,
cataract
or to
first, and then for kids also.
usage of mobiles and the screens should definitely reduce. I think that's very, very important. Diet. I think diet, what we eat, what we consume. At the same time, many of us go anorexic. They want to not eat. They want to look good,
Yes.
feel good. That's another thing. So I think a very good healthy diet is absolutely mandatory. Third is, I would think, regular health checks.
Yes.
Everyone must get into that habit of getting there. We tend to go to the doctor when we are not well. We tend to go to the doctor or get our blood test done when we are sick. I think that should be that type of system should change, and people should regularly go and get themselves checked.
Lots of things are coming in early age.
I think people should revert back to their
Revert
old,
back to,
yeah,
yes,
revert
yes.
back to their old. I think we are, as such, to tell you the truth, is we are becoming too westernized.
Yes.
I think if we go back to our roots and go back to our culture and go back to our habits, what our fathers and mothers taught us and fed us, I think we can revert a lot of things back
So we
for
can
us.
say that now the young girls and young boys, if they are taking their health seriously, and they should take care of everything about them, so their children might not have these problems.
Yes, very true.
Yes,
Very,
yes.
very true.
So thank you so much for taking out the time and giving us this information.
You're always welcome. I hope I have given you some
Yes,
information
sir. Yes, yes,
and
yes. Very
done
informative
justice to
session.
your podcast. Okay.
Thank you so much, sir.
Thank you.
Thank you.